This is
Well, that's the price you live to pay in Canada, buddy. The best country on earth with the free healthcare, right? Speaking of that free healthcare, let's see how well it's doing.
it's not
Yeah.
free.
Well, it's not free. It's not free. It's about 35-40% of your income tax. So for me, that's like
How much? How much?
I pay probably personally like 15 or 16,000 a year into it. Anyway, this is comparing the performance of universal healthcare countries in 2024. I think we're gonna like skip through most of it. I really just want to get to the graphs down at the bottom, where we can see how we're doing against these people, these other people. So where's number 2 here? We probably should check that one quick. I should have. So how much does Canada spend on healthcare compared to other countries? We come in 9th with 11.5% or $7 billion spent on, or 7,000 million, as Graham would say.
What's the percent mean? A percentage of what?
GDP, which is, so this is kind of telling right here when we're spending, we're 4th when you count our percentage of GDP spent on healthcare, but 9th when it comes to actual money spent. So it kind of shows you how shitty our GDP is. But we're spending $7 billion a year, so it's not cheap. There it is here, fourth in spending. Down here, that's in the per capita adjusted. Let's jump down to the bottom here when it gets. Let's get to the meat of it. So for all of the money that we're spending, physicians per 100,000, we're 29th out of 31 countries. Nurses per 100,000, we're, I don't know, maybe 12th. Somatic care beds per 100,000, we're in the bottom 5. The UK is a little worse. Korea is killing it. I mean, especially when all those people start dying. What are they saying, like South Korea right now? For every 100 South Koreans right now, there will only be 4 grandchildren. So they'll have tons of beds. We could buy some beds off them. For resources, MRI units per million population, we're 26 out of 31, down with Denmark, United Kingdom, Israel, and Hungary. Top of the list, which could be interesting, Japan, Korea, Greece, Norway, Germany. CT scanners per million, we're 27th out of 31. UK's last.
What? Where's all the money going?
I don't know. Consultations with doctors per capita, we're right in the middle of the pack. 3 under average. Average would be about 17th, I think. Or yeah, there's 31 countries total. Curative care discharge rates per million, age adjusted to 2022, dead last.
Dead last. What does that mean? Curative, as in like you've been discharged because you're healthy again. You're cured.
Yeah, you're cured, not dead.
We're last.
Last. I mean, when MAID is like your number 2 or number 3 killer, explain it. Percentage of patients who are able to make same day or next day appointments when sick, dead last. Percentage of patients who waited more than 1 month for an appointment with a specialist, second last. Percentage of patients who waited more than 2 months for elective surgery, dead last. Percentage of patients who found a cost barrier to access medical and dental care in the past year. We're not even first place for that. We're 7th. So there's, I mean, we do have quite a bit of American listeners. So I just wanted to, I figured that'd be a good rundown of infant mortality per 1,000 live births in 2021. We are 29th out of 31 developed OECD countries.
What's the one underneath New Zealand?
The Slovak Republic.
Wow.
So even, where's the USA on here?
I don't think they're in
Oh,
any of
they're
them.
not on here because they have, but they would be down right around where we are because their infant mortality is almost identical to ours. They don't have universal health care. So, I mean, if you're going to have a kid, it looks like Finland, Japan, Slovenia, Sweden. I mean, your odds of it dying are half.
Yeah, that's not good. I'd love to see where the money's gone. Or where the money.
Untreatable mortality, we're like 1, 2, 3, 4,
What about suicide? Do they have suicide on here?
19th.
They have maid
19th.
pods, maid service. We're first in maid service. I bet.
We're guaranteed we're first in killing people. Made you dead. That's it. That's
All
all.
right. Well, that's good. Can you send me that report, or can you send me?
Well,
We'll put a link in the show notes, right?
I can put a link right here
Yeah,
now.
that's interesting. Yeah, for all the people that think Canada's healthcare is free and so good.